I'm Natalie Kunsman, MD, and today's topic, per request, is about grief. So, Elizabeth Kubler-Ross, many years ago, defined some stages of grief, which seem to hold true. And of course, when we're talking about grief, we certainly are very familiar with the loss of an important human in our life, but also this may describe pets, or it may even describe episodes of life or chapters of life that are viewed as grief-like. So one of the first stages is denial, and that's an obvious one, and that's at the first time you are feeling shocked or numb regarding the learning of a loss. And it's the first mechanism to try to deal with this really overwhelming emotion. And then we have anger, and that's as sort of that reality is setting in and the obvious feelings to try to direct toward that concept or other people or life, and even sometimes to that particular loved one that has passed away and left you alone. So we have a third phase, which is the bargaining phase, and you may dwell on the what if and if only, and I should have, I could have, I would have, if I would have. Then we get into the depressive phase, and this is really what a lot of us understand, which is intense sadness. And depression can be in the mood-related issues as well as some of the vegetative symptoms such as sleep trouble or loss of an appetite. And then the final phase is the acceptance phase. And you may obviously still feel sad, but you get to a point where you can accept the reality of your loss and maybe even potentially start working on moving forward. So while many of us go through all 5 of these stages, and maybe not even in that particular sequence, there is no right or wrong way as far as those very nitty-gritty details for our coping mechanisms. And there honestly is no time frame either. But we start talking about complicated grief or complicated therapy when the return to function has just been arrested. Now, some of the therapies that we consider are supportive therapy, client-centered therapy, meaning-oriented therapy, brief dynamic therapy, cognitive behavioral therapy, interpersonal therapy, pastoral counseling, play therapy. Now, this is obviously if we are dealing with youngsters that are having grief issues. Logotherapy. This is interesting. This is one of the concepts of trying to find the meaning of life. There are people who do writing therapy, internet-administered therapy, virtual reality therapy. Now, this is a very interesting concept too, where you will have virtual technology that is actually putting you in the situations that you're trying to overcome. So going into grief situations that you are learning to overcome. And the concept is if you can get over this fear or exposure, you will gradually increase your responsiveness in those situations to overcome them. And then we may have some therapy talk before and after this. And sometimes this will help you process in the healthiest way possible. And then, of course, there's also the therapy of hypnosis. Now, there is medicine. There is a role for that in only the most profound of cases, and sometimes in those patients that are already dealing with the depression and anxiety and the grief on top of it. I would say a superb source for my understanding of grief and death is actually Raymond Moody. And Raymond Moody is a psychiatrist that heard stories over and over and over of the near-death experiences of some of his patients and how that came to provide a lot of meaning to him and his approach to patients going through grief. So he has written at least one book called Life After Life. And I also encourage you to consider any of the YouTube channels to hear his recounts from his patients and his interpretation on that. And of course, the idea of the afterlife is so comforting for many of us. I also want to give some resources that are out there to help us deal with our grief. So hospice, and there is a national hospice and palliative care organization that can provide a lot of tools for grieving. There is a National Military Survivor Helpline. And basically, if you're not really comfortable with an in-person type of talking, the Tragedy Assistance Program for Survivors, or the TAPS program, is a 24-hour helpline, and you can reach the National Military Survivor Helpline at 1-800-959-TAPS, T-A-P-S. Now, there are support groups, and you may find a lot of help in the local support groups. And to find one near you, you want to go to grief.com. Some other places you may not have thought of. Well, hospitals have resources. Colleges have resources. Funeral homes have tremendous resources. And churches have a lot of resources for grief and grief counseling. Let me just say that I have heard, and I believe this wholeheartedly, that effective mourning is not done alone. And a lot of times your support network, they have gone through the grief process and have finished long before you have. But you may have a much longer need to be talking about it, and some of those unexpressed feelings can be really distorted. So please find your understanding and non-judgmental listener where you can openly discuss your feelings and experiences and work through your pain and come to terms with your loss. Sometimes that is professional. Sometimes that is your inner circle. So another quick idea that is really something to embrace is that death may have ended your loved one's life, but it really did not end your relationship. And that bond that you have had with that person will continue and endure through your lifetime. And depending how you take your memories and your past with you, with that person, into your future. So many people who are grieving will maintain an active connection with their deceased loved ones by dreaming about them, sensing their presence, or feeling watched over and protected, and this is normal, and this is okay and healthy to foster those continuing bonds. There is this concept also that time will heal grief, but time doesn't really heal the grieving process because time is kind of neutral. And it's what you do with that time that actually matters. And now that this death has happened to you, you must decide what you're going to do with that grief. And grief is an active process, not a passive one, and recovery is a choice. So I hope I've given you some resources, and I hope this spurns some dialogue, because again, some of our internet processing and friends and inner and outer circle can help you in your process. Again, I am Natalie Kunsman, MD. Please subscribe to my channel below. And until we meet again, be well.